In the meantime, I want to go to Ontario Liberal MP Kamal Khera. She has announced that she has tested positive for COVID-19. She's also a registered nurse, and just before this had signed up to help ease nursing shortages by offering to do some telehealth calls. She is self-isolating now at home, and she joins me on the phone. Hello.
Hi, Rosie.
How are you feeling, Kamal Khera?
I'm still feeling my symptoms, as you can probably tell by the sign of my voice, but I'm doing fine, thank you. But I know so many other Canadians are experiencing much worse symptoms, and I just want them to know that we're all thinking of them and that we'll get through this together.
There are so many people who don't have this and are trying to understand what it feels like. Can you give them a sense as how you're feeling, or how it feels differently than a previous illness or another kind of illness?
Well, Rosie, I can tell you honestly, I've been feeling mild flu-like symptoms throughout. It comes and goes. It seems like one of the worst flus that you can have. That's what it feels like. And you have some good days, some bad days. Today seems like a better day for me.
You are, as I mentioned off the top there, you're a registered nurse. So obviously you know all about public health, and I imagine you were protecting yourself. What does that tell you about COVID-19 and how contagious it is?
Well, I think, Rosie, what's important to understand is that we need to be extremely mindful and follow the recommendations that our public health officials are reminding us every single day. And just know that no one is immune to it. We all have to be very, very careful. It is in our communities. It is, you could be a healthy individual like myself that was practicing social distancing and is very, I'm a germaphobe and wanted to make sure I wasn't washing my hands. Just know that you have to be very, very mindful of what you're doing. So please follow the expert advice. Stay at home. I can't stress that enough. Stay at home. Practice social and physical distancing. Self-isolate if you have symptoms. We owe it to Canadians, to our frontline workers, to the most vulnerable in our communities, to our seniors. Every single one of us have a part to play in flanking the curve and to get through this together.
I know you answered the call to be a telehealth nurse. Were you able to actually even start that before you got ill, and if so, why was it so important for you to get involved in that?
Well, honestly, Rosie, when I saw the RNAO's initial call for action to ease nursing shortage, there was absolutely no hesitation that I was not going to put my hand up. Helping people at the front lines is my passion. I've worked at the front lines before getting involved in politics. It's one of the reasons why I got involved in politics, and it was an absolute no-brainer for me to register to put my name forward. I still remain on that list. I look forward to contribute to those front lines when I'm called. I unfortunately didn't have the chance to, but I look forward to doing that even virtually now that I'm home. But I also wanted to make sure that I use my voice to shed the light on the reality that we could possibly have a shortage of nurses and amplify the message. And I'm so proud that over 4,500 retired or non-practicing nurses that have signed up for and have registered with RNAO to volunteer. And I'm so incredibly proud of this group and can't thank them enough for what they're doing.
Do you have any idea how you got it? How you got the virus?
Well, as I said, I think it's a widespread virus, and so many people, may have it and are still walking around in our grocery stores and are still walking around outside. And I think, as Dr. Tam said, this virus sees no color, no age, and we have to be very mindful. Listen to the experts. Stay at home, practice social and physical distancing. It's so important that we listen to the experts and commend the leadership of, Dr. Tam, Patty Hajdu, and our Prime Minister every step of the way.
So just to be clear, it wasn't travel. It was somewhere in the community or someone that you met, something like that.
Well, as I said, Rosie, we simply don't know because, just like everyone else, every other Canadian, I'm trying to do our part, I did travel from Ottawa to Toronto when we came back after the House rose. I've, did go to my office once or twice, did, try to do grocery shopping, before I knew that I had to be prepared. And again, I think it's just important for us to listen to the advice of our public health officials. please stay at home and follow the instructions of our public health officials every single day.
I think you talked to the Prime Minister yesterday, and of course his wife, Sophie Gregoire Trudeau, is sort of coming on the other side of this now. What did he have any advice for you in terms of how to keep working and how to cope with the virus itself?
Yes, I mean, I was extremely touched by that he took the time to call me, considering all his other priorities. He called to just check in to see how I was doing and also to share his experience, as you mentioned, having been through it with Sophie on some of the ups and downs of symptoms. And it was really nice to have him give some of the tips working from home, which I know so many Canadians are doing right now. But it was also important to also catch up, considering we haven't seen each other since the House rose, and had a chance to tell him what I've been hearing from the ground in my community and why his messages every day are so important to Canadians and the work that we have been doing every single day, whether it is bringing Canadians home or helping people that are struggling every day during this unprecedented time.
Okay, Kamal Khera, as you and you're right, other Canadians struggle with the virus, we do wish you the best of health.
Thank you so much, Rosie.
All right, thanks for taking the time. I know it's not the first thing top of mind when you're going through this, but it's important, I think, for Canadians to hear from you. I appreciate it a lot. Get well soon, and we'll talk when you're out of self-isolation.
Certainly. Stay safe, my friend. Take care.
All right, you too. Thanks. That's Ontario Liberal MP Kamal Khera. As I said, she tested positive for COVID-19. She's, of course, the MP for Brampton West.